depression is a constant feeling of sadness and hopelessness, and this feeling has to happen for 2 weeks before you can actually say someone is depressed. Like his mom was always beating up his father. See, today he's struggling to even get married or even have a partner because he said, like, yeah, that the idea of a woman beating up a man hasn't gotten off his memory. Same as women too, who experience maybe abuse or seeing their mother being abused by their father. Some of them become highly masculine, and the constant reoccurrence of that thought keeps coming back to their mind.
I am excited to bring to you yet another edition or episode of Health Hustle. It's a journey where we conquer wellness and health one episode at a time. And it's another topic for discussion today. As we all know, health is wealth, and it is very important to take it very, very serious. What we are going to be talking about today is another topic that is quite related to the previous ones that we've been doing before. The essence for this program is nothing but to give you elaborate explanations about your health, like very, very detailed from experts, to give you not just basic, but deep knowledge from their wealth of knowledge. They share with you this knowledge for you to live a healthy, a happier life. My name is Boma Green, and this is Tipok TV. And I am not going to be doing that alone today. I have a guest in my midst, like always. She's an expert. She's an occupational health specialist. She's also a mental health enthusiast. You can also call her a mental health therapist. Yes, she's very, very good at what she does. She's always looking ravishingly beautiful. I don't know if that sounds good, but she's always looking ravishing, like beautiful. She's not another person than Ms Prisca Obi. She made mention of that previously, that we should call her Obi, that she preferred that. So make welcome Ms Prisca Obi. You're welcome, ma. How are you doing?
Thank you. I'm fine, thank you.
Okay, we are going to be talking about post-traumatic stress disorder. The acronym is PTSD, and it's another type of mental health disorder. Like I told you, she's a mental health expert. So we are going to be talking about that today. So, ma'am, first off, what is post-traumatic stress disorder?
Okay, I know it's not really a popular mental health issue that people talk about, but the funny thing is that a lot of persons experience it without even knowing. PTSD simply stands, just as you said, post-traumatic stress disorder. When we say post, it means something that have happened in the past.
Yes.
In a layman understanding, it's simply a form of disorder that comes as a result of past experience, and it's accompanied with fear, reoccurring scary nightmares, or hyper vigilantation and all of that. So it's just a form of trauma. Maybe when an individual have experienced trauma in the past, there'll always be a flashback of the trauma, and the person will constantly feel the fear. Or maybe if the person is in an environment that reminds him or her of that particular trauma, the whole feeling comes back new and fresh. Yeah.
Okay, talking about this PTSD, what sets it aside? What makes it different from other mental health issues like anxiety and depression? Is there like a specific difference between this whole thing?
Okay, so sometimes they can actually be interrelated. Someone can be going through PTSD and you say the person is having anxiety, or the person has depression. But there is a distinctive thing among three of them. Like I said, post-traumatic PTSD is as a result of past experiences that could bring the pain back. But then for anxiety is just constant fear. There is always recurring fear. For it may not be the trauma, someone may not experience any trauma but could just have fear. Like I know people who are anxious of getting pregnant. They've never experienced pregnancy before, but each time a thought of getting married and then they're going to get pregnant comes, like they'll start having
because
anxiety.
of the experiences from other persons.
Yes, from other. And then for depression is a constant feeling of sadness and hopelessness, and this feeling has to happen for 2 weeks before you can actually say someone is depressed. A constant feeling of sadness, restlessness, fear, and hopelessness. But then why PTSD is as a result of past experience. Maybe you must have witnessed or experienced any traumatic event. And
Okay.
so but the feeling and the flashback comes back. So this the distinctive thing is that depression is a feeling of sadness and hopelessness. Why anxiety is fear, why PTSD is a recurring feeling of a traumatic experience one had in the past. Yeah.
So we could actually say that everybody go through this PTSD, because there are a lot of things that you might have experienced. Like, I mean, everybody should be going through this PTSD, because I mean, one way or the other, you could have gone through something that is traumatic that reminds you of that thing every time.
Yes, not really, because there are actually people who are raised, like I always go back to upbringing. There are actually people who have smooth lives
Okay.
and they do not really have any form of PTSD and all of that. Though there are acute and minute PTSD. But for me, I think I had my own fair share in boarding school. I seen her who punished me one time and she went to have a bath, then came back and sprayed body fantasy, the green one.
Yes.
And it has this one fancy smell, cucumber, the cucumber, I don't know. Yes, I know I can still remember the bottle. So each time someone sprays that perfume and passes where I am, I'll
You
always
remember
remember,
the senior,
is
yeah?
this senior use this body fantasy. You
Yes.
could imagine this happened like, let me say, 10 years
They
ago.
go.
I can still remember it today. So if PTSD, just you always remember what happened in past, and except if it's something really really hard, maybe a very terrible experience like war or sexual assault or
Yeah.
abuse, or maybe you seeing your mother being beaten. I know of a boy who said that um his mom abused his father. Like his mom was always beating up
Beating
his
his mom.
father. See, today he's struggling to even get married or even have a partner, because he said,
He's afraid.
like, yeah, that the idea of
Yeah.
a woman beating
Beating a
up a
man.
man hasn't gotten off his memory. Same as women too, who experience maybe abuse or seeing their mother being abused by their father. Some of them
Like, I'm
become
not going.
highly masculine,
Yes.
and the constant reoccurrence of that thought
Incident.
keeps coming back to their mind.
Okay.
Yeah.
Can you explain the neurobiological changes that occurs in some persons that go through PTSD?
That's the things that happen in the brain. When people go through PTSD, there is a three part of the brain that experiences changes. The part that processes emotion, and when someone goes through PTSD, that part of the brain is hyperactive, is hypervigilant, like, because the moment you remember that thing, that emotion comes
Comes
back
back.
new.
Yes.
Like it
Afresh.
just comes back afresh. And then there's also a part of the brain, the hippocampus. That one is the one that distinguishes past, present. But then because you're having PTSD, or one is having PTSD, that part of the brain shrinks and the brain is not able to distinguish a past and a present event. So
Wow.
if you have any trigger, or if you see somebody who looks like somebody that slapped you, or get to see something that looks like a trigger or what happened to you in the past, your brain will be able to realize that this is not the past.
Yeah.
The person begins to react. If it's fear, if it's anxiety, or if it's even screaming. There are people who experience physical pain
Yeah.
as a result of what happened to them in the past, or some women who were sexually abused as kids and they are married. Each time the husband makes any sexual advances on them, they begin to feel that same pain of the rape they had as children. So this part of the brain shrinks and is not able to distinguish between the past experience and
the
then
present.
the
It
present
just
one.
makes it looks as though it's
Is
happening again.
yes.
Again.
And then the prefrontal cortex, like the one that is in form of decision making, because this person is already sad and a lot of activity are just on the person's brain. This person will be able to really make a right decision
Choices,
immediately,
yeah.
because the brain is hyperactive. And so these are just the three parts of the brain that gets affected when one has PTSD. Yeah.
Wow. Okay, so moving on. Um this PTSD could actually occur differently in different people, depending on age and culture and whatever religion could actually affect it. So, but in the aspect of age, how does PTSD manifest differently from children, adolescents versus adults?
Okay, over time, research has shown that children may not really be able to express what happened to them,
Yes.
but there are a lot of things that have been noticed, that have been observed among children who are going through PTSD. First, they notice clinginess. If a child has experienced any form of traumatic experience or any form of trauma, you will see the child always wanting to stay around somebody. Let me say a child who is sexually abused,
Use.
the child will always want to stay around somebody he or she feels safer than trying to be alone or stay
Yes.
alone in the dark. Or some of them bedwet.
Mm.
So bedwet is actually a form of PTSD and people don't know.
No.
You think maybe it's the child is just being lousy, but it's a call for action for parents to pay attention that when your child is bedwetting, it doesn't necessarily mean that the child has an issue, but it's something you need to look out for. Is there any change in this behavior?
Mhm.
And then reacting, recreating, like some of them will start acting drama. If you
Yes.
sit at a side to watch them, to see the kind of games they are playing,
Playing.
you'll be able to see some of them recreating the trauma in the games they are playing. Maybe they are playing with their doors and someone slapped them, you see them
Slapping
slapping
the
and
door.
beating the doors. Yeah. And then for adolescents, which are like the teens and
Yes.
all that, some of them become really aggressive.
Mm.
Yeah, they become really aggressive, and some want to start taking alcohol or taking some risky decisions and all that. But then for a full grown adult, because it's something that maybe happened as a child or as a teen, there will always be
Reminder. Yeah.
constant flashback of what happened.
Mm.
Yeah.
So it's actually a call to look out for your children, your teens, and know if they are going through this thing because it is very, very important. So moving on, can you tell us the relationship, or should I say the intersection between PTSD, depression, and anxiety? Is there any similarity to these problems?
Yeah, because they all come from pain.
Okay.
Yeah, they all come from pain. Apart from anxiety, that there is nothing really clear. You're just scared of something you've
For
not really experienced.
yes, fear
Yeah.
of the unknown.
Yes, fear of the unknown. So the only similarity is that they affect your mood, they affect your decision making ability, they affect how you feel. They can make you judge people wrongly because of how you're feeling inside. You will always express that to others. And if you're feeling sad, you could possibly see everyone as a suspect or as a trigger of your sadness,
Yeah.
and your behavior won't generally be accepted, and you just be called a weird person.
Yeah. So, like every other problems, like mental health and all of those things that we explained, measures to take. Are there any evidence-based treatment for post-traumatic disorder, stress disorder?
Oh, all right. First of all, I'm not permitted to talk on treatment options.
Okay.
That's because my job as a health educator is on preventive medicine. We teach and we educate. But the only thing I can actually recommend is therapy.
Okay.
Yeah, there are lots of treatment options, but I do not have the right to mention treatment options. That's because I'm not a psychiatrist, and
Okay.
only psychiatrists can give you the right medications you
To
can
take.
take. Yeah,
Okay.
so but then they don't air it out because these are drugs that could alter your behavior. When people can take it or
And
even
abuse
abuse
them.
it, yeah, so they don't just recommend it anyway. The only thing I can just recommend, if you think you have PTSD, you're constantly having a flashback of what happened in your childhood. Maybe like me, I also saw a terrible car accident. Each time I pass through that road, I still have a
Remember.
flashback of it, but not like it comes in my dream. But there are people who maybe that constant flashback of
Yeah.
it, and they always see it in the dream, but mine do not come that way. So but then I recommend therapy if your own has gone so severe that you're constantly anxious, it's affecting your daily routines. I think you should see a therapist, and from there the therapist can maybe recommend if you need to see a psychiatrist or go for a brain scan to really know the exact cause of
Okay.
what's wrong. Yeah.
Okay, like I said to you before, we bring to you problems, we talk about these problems, and we deal with them and tell you measures to take. And that is the sole purpose for this program. We're going to be calling it a wrap for today. It has been a pleasurable journey with you, a beautiful discussion. I guess you should be learning one, two, three, or more from this. And I hope this video helps you in one way or the other. My name is Boma Green. This is TikTok TV once again. Please do well to subscribe on all our platforms. We're on YouTube at TikTok TV, Facebook TikTok TV, and Instagram. So do well to follow, subscribe, and follow for more videos like this. Bye.